Just a quick program change. Your program says I'm supposed to moderate this session on enhancing operational response, but that's not really the case. Dr. McKinney will be doing this session, and we will be switching out for this afternoon. So, Dr. McKinney.
Thank you, Ken, and good morning, everyone. Welcome again to day 2 of our workshop on the California wildfires. As Ken said, I am Dr. Suzet McKinney. I'm a member of the planning committee for this workshop, and I also serve as co-chair of the National Academies Forum on Medical and Public Health Preparedness for Disasters and Emergencies. This morning, I'm going to be moderating session 7, which will deal with exploring enhancing operational response. So I don't know if any of you have had a chance to review any of the readings and resources for this session, but if you did, you surely have gained some insight into some of the things that the panelists are going to be speaking about this morning. Some of the things that I noticed from those readings and resources, particularly from Dr. John Balmes's article, When There's Wildfire, There's Smoke, he talks about the effect of catastrophic wildfires, particularly when they impact populations living in urban areas where large numbers of people are exposed to high levels of smoke containing a number of hazardous gases, compounds, and other pollutants which cause extreme adverse health effects for those exposed. Yesterday, we talked quite a bit about the mental health effects of these events on first responders, but we did not talk very much about the mental health effects on children. And as depicted in the Brown et al. Study of adolescents in 2 Canadian communities, there is evidence of significant increases in depression and suicidal thoughts among adolescents following these events. So as planners, responders, and stakeholders, we need to be planning and paying particular attention to how we will identify pediatric patients that are at highest risk for developing psychiatric symptoms after these disasters. And among the many concerns during an operational response to any disaster, but particularly wildfires, is messaging and communication. The effectiveness of public health messaging to help those affected understand evacuation orders, how to avoid injury, and overall protection strategies are critically important. So with that said, our panel this morning will speak to us about all of these issues and likely a few more. So with that, please join me in welcoming our panelists this morning. First, Dr. John Balmes, who is the director of the Joint Medical Program and professor of Environmental Health Sciences at the University of California, Berkeley. Dr. Balmes. And despite what your program says, we have Chip Schreiber with us this morning, who is a professor of clinical pediatrics in the Department of Pediatrics at UCLA's David Geffen School of Medicine. Dr. Schreiber, please join us at the front. Also joining us is Dr. Tina Palmieri, who is the Assistant Chief of Burn Surgery at Shriners Hospital for Children of Northern California and Director of the UC Davis Regional Burn Center. And finally, joining us remotely this morning, my good friend and colleague, Stella Fogelman, who is the Director of Emergency Preparedness and Response at the Los Angeles County Department of Public Health. Please join me in thanking them all.